Hello, everybody. Welcome to another session on One Question a Day. We are continuing with our tooth morphology, and today we are going to discuss a general question. Most of the time in the university exams, in any university, in this paper of dental histology and tooth morphology, there will be one essay question asking about to detail on tooth morphology of any particular tooth, usually about the canines, premolars, maxillary molars, mandibular molars. And there is a specific pattern that we as examiners expect from you along with diagrams. And when that such a question is asked, usually it's an essay about 10 marks, 10 to 15 marks, depending upon your university. You are expected to write a brief introduction wherein you need to detail about the salient features and other name of the tooth. For example, if it's a canine, talk about the cusp-plate being the cornerstone of the mouth and how unique it is, only one per arch and longest tooth, such salient features, because each of the tooth has its own salient features. So that has to be mentioned in the introduction part. And remember, this is a catchy phrase and use it to your advantage because the examiners will be impressed by how you introduce the tooth to them. Then talk about the nomenclature in all the three, FDI, universal, and the Zygmore Palmandi. All the nomenclatures, it is better to write. And if it is a generic tooth, talk about like maxillary molars, say about all the tooth, right? Usually they don't ask, they are very specific about first molar, second molar, such that. So be careful about the nomenclature. And the next phase will be the chronology. Usually talk about the initiation if it is mentioned, or the first evidence of calcification in weeks or months, as you know, the approximate of enamel completion, approximate range of enamel completion in months or years, the approximate months or years of eruption of that particular tooth, the root completion, expected root completion in normal course of event. All this has to be very clearly written, right? I would say that preferably put a table with a range, not a particular month or a year, but a range, say 15 to 16 months or 16 to 18 months or 16 to 20 months, but be as close as possible. You can refer to your wheelers for all the range for chronology. Dimension, again, be specific, put a neat chart. You have 8 different parameters that to be mentioned, and always mention the units very clear. I would say that put a table in mm, crown length, root length, mesiodistal at maximum, mesiodistal at minimum, that is cervical, buccopalatal or whatever the condition is, labiolingual or whatever the dimension, maximum, minimum, depth of curvature along the mesial aspect, along the distal aspect, height of curvature if you know it. So these points has to be mentioned in a sequence. These 2 tables and this introduction will convince us as examiners that you have understood or know the subject very well. Then comes we will describe the tooth in classic 5 different formats. Next, that is the buccal or labial aspect, palatal or lingual aspect, mesial, distal, occlusal or incisal aspect, and the root. So while going into each of the things, always mention this 8 points: shape, mesial outline, distal outline, occlusal outline, the cervical outline, the surfaces that are seen here, which are not seen here, which are visible. Talk about where the contact point is. In the mesial outline, you have to say initially from the cervical line, it forms a convex surface or a concave surface, projectial till 2/3. Then after which it takes a sharp bend. All this outline, progress of outline has to be mentioned. And it would be ideal if you put the diagram of this along with this towards your right hand most corner in a box. That will convince us as examiners. And remember this, if you follow this point, you will never miss anything. The same thing holds good for the palatal or the lingual aspect. Now coming to the mesial aspect, you talk about the shape, buccal outline, palatal outline, occlusal outline, cervical outline, surface contact point. The same thing for the distal aspect. If for occlusal or incisal, start with the occlusal outline for the shape, rhomboid, triangular, wedge shape, the number of cusp or cuspid seen with their names, the names of the grooves, the names of the fossa, ridges, pits. These are basic minimal that we expect from here. If it's like mandibular second premolar, talk about the two cusp, three cusp types, name, the grooves, fossa, ridges, pits everywhere, right? And oblique ridge, be specific from where to where, mention all the names. Then come to the pulpal morphology, the number of lobes, position, how the anatomy at the superficial layer, at the cervical layer, and at the apical region, how the morphology changes. And contact and embrasures, name and position, and clinical consideration, if any. For example, lateral incisors are often morphologically different. Canines or longer tooth, again, re-emphasize all those points and say why this tooth is unique. If you happen to, and right from the first assignment or question, if you start to follow this chronology or sequence of answering, you will score the best of the marks for your tooth morphology essay. I hope this brief video will help you to answer your tooth morphology essay to the best of your ability. Keep following and stay connected to this channel to learn more on how to answer effectively and learn one question a day. Thank you.